This is a different concept of chopping of the hard nucleus. There are so many modalities and techniques are there. Of course, the innovator of terminal chop. Along with that terminal chop, there is also one more technique is the align chopping, which I feel is very comfortable for me, especially in the Brunnensen's nuclei, white cataracts, weak zonules, capsulorhexis tear, and the small people. This chopper works well. So if we compare all these techniques, the horizontal chopper is compressive force, fracture of the nucleus and crushing edges are there of the splitting zone, and in vertical chopper there is a shearing force, split the nucleus, edges appear sharp, impaled, we have to impale downward. But in the align chopping, the chopper is angled, we have to insert it at the 30 to 40 degree away from the main port, follow the curve of the instrument, nucleus doesn't spin along the axis of the the Phaco tip. Most of the time in the hard nucleus, when you impale it, it rotates well. So no compressive force and no crushing edges, it chops the sharp, clean margin. So just see the chopper design. The chopper design is almost, this is a long stem, and then there is about 30 degree tilt is there. It is something like this. You can well estimate. And when you impale in the center and you chop from the periphery to the center, then it's make the two halves very neat and clean, and it chops from periphery to the center. Now you see, this is the chopper, and from the left hand surgeon is a left band, right hand surgeon is a right band. Now see, brown hard cataract, insert the chopper along the line of its course and follow the curve, and it chops like this. And this angle also makes easy to separate the two hemispheres. This is how we just rotate it, impale it, hold it, and go to the periphery, and it's clean cut chops. The blade is towards the tip, not angled, so it chops. Hold it again, because this is a very thick nucleus. Hold it firmly, and it separates. Again, you see, we have done a good capsular axis. In these cases, allows make a big CCC, because you have to go into the periphery. It will allow your chopper to run comfortably inside. Just make a small crater from paracentral to the central area. Hold it, go along this curve, hold the nucleus, and go to the periphery. Hold it firmly with a high vacuum, low ultrasound, and it chops. This is align chopping, classical chopping. You just see the two hemispheres separated. So just in case you want to do the good chopping in hard cataracts, you can make your chopper in your operation theater. Of course, it is very good for the grade 1, grade 2 cataract and grade 3 cataracts also. You just hold it, and as if you are doing the vertical chopper, you can use it as a vertical chopper also. This is pure white cataract, grade 5 cataract. You can chop it in the same fashion. Just hold the nucleus in the center. Go towards the periphery. You see the aligned chopper is a little aligned. And just chop towards the Phaco tip. So this is the take home message, is just hold it and chop is towards the Phaco tip. It is align chopping. Thank you very much.
Very nice, innovative. I think it was nice. I think, is there a change you need in the way your finger moves?
Yes, this is only an angle, which is actually, I have given a short diagram over there, where you have to put your chopper just 30 degree away from the main incision, because the chopper is bent about 30 degree. So the force is dynamic force is towards the tip, not towards like this. Most of the time, what are the choppers we are using? They are using, the blade is like this, and you are not chopping exactly, you are just crushing the lens. So most of the time in hard cataracts, what happens, it spins on the axis of the nucleus. So in this chopper, what happens, you just impale in the center and chop. The blade is like this, and it chops straightly. So this is classical chopping technique. This is a classical chopper rather than the crushers.
Yeah, true. Dr. Dharmendra has shown very nicely, because this is something like you're cutting the nucleus.
Yes.
You're cutting the nucleus
because
with a very sharp
means
chopper.
Chopper, you have to chop it.
Yeah, with the chopper you have to chop. But this is something like you're cutting it, and you're beautifully showing. But only important point here is like, especially the cataracts, which if you have a moderate grade of cataracts, like grade 3, 4, 5, this will work very well. But if you have a cataract of grade 5, 6, and 7, like more
Even
than
then
6,
you can chop it.
then the cutting the nucleus will be very difficult. Then you have to crack the nucleus. So the cracking technology has to be used.
There are a variety of the choppers. If this is a hard nucleus, then you have to take a chopper 2.5 millimeter long shaft. So it chops whole of it. You just try it once.
Yeah, that's what I'm saying, because then the cutting becomes difficult, you have to crack it. And for cracking the nucleus, you have to use crackers. So the crackers, like we have introduced that Terminator, the terminal chopper cracker. So that is a cracker. Basically, you hook the nucleus and you crack the nucleus. You don't have to cut the nucleus. If your nucleus is like rock hard or very hard cataract, then you can't cut the nucleus. You can't cut with the choppers. You have to crack it. So, but his technique is going to work very well in a grade 3, grade 2, grade 4 nucleus, definitely, because you are cutting the nucleus, and it's beautifully shown how you split the nucleus, you cut the nucleus. Thank you, Dr. Dharmendra.
Thank you.